Okay. So what you do? Okay, you have this. You give a 2 initial subsequent breath. Wait for the end of expiration. After that, so how often you want to embu bagging? So for those without embu bag and that face mask, you need to do a compression 30 followed by 2 breath. But for those with this embu bag, so how many embu bagging, and then after that you do compression. But actually in this case, once usually if like this, actually more than one person available. Okay, so the rescue is more than one. So that means all of one is doing the ventilation with embu bag, the other one is doing a cardiac massage. So how often? How many? It's similar. It's similar. So that means you have to do a cardiac compressions with the numbers of compression is 100 to 120 compression in 1 minute. So that means you have to compress the chest 2 in 1 minute. 2 in minute. 2 in not 2 in 1 minute. Not 2 in 1 minute. 100 to 120 in 120 in 1 minute. So that means each 1 second you need to do a 2 compression in 1 second. So that means very fast you need to compress. And make sure when you compress, so the deep of that compression in the chest is range from 1 to 1.5 inches. 1 to 1.5 inches mean how many cm? 2 to 4 cm deep compression. So this considered as adequate, okay? Adequate compression. And then make sure, okay, the chest become recoil first before you do another compression. So this is considered as good, adequate CPR. So you must compress 100 to 120 per minute. Make sure, okay, the chest recoil first before you compress. And then the depth of compression, okay, of the chest range from 1 to 1.5 inches or 2 to 4 cm deep. So the volume that you blow to the patient actually is around 100 mil. This is for adult. 100 mil. If you blow 10 to 12 breath per minute. Okay. So this is roughly what you do. Okay. 30 compression, 2 blow. If 120 compression, so time 4. So it's actually 8 blow only. 8 blow is less than 100 mil. But actually you need to blow more than 10 or more to achieve 100 mil. So therefore, you need to do 120 breath, more than 120 compression per minute. It's not that easy. So make sure you are in the good state that you can do a cardiac compression. So therefore, if you are a medical student in the ward, okay, the houseman already done it, the nurse already done, they got exhausted, so you have to take place. So therefore, you need to learn this before you go to the ward, how to do a proper CPR. So how to locate the your palm is very important. So how to locate it? Look at the picture. So CP sternum, you feel the CP sternum. Feel the CP sternum, and then make sure your palm is actually 2 finger breadth from the CP sternum, and then your palm actually you put at the sternum, and then you use a two hand. So we will demonstrate this to you, okay, during next weeks in skill lab. What do you mean by proper compression? For normal people, you can use a nipple line. Okay, sometimes obese female patient difficult to identify the nipple line. Okay, so therefore the most important actually you just identify the CP sternum and then put your fingers, your palm at the sternum. So this is the way how you do how you put. There are few this one I will show you later. Not today, maybe tomorrow. So this is compression. I already mentioned just now. You have to count 1, 2, 3, 4, 5 until 30, and then ask your friend to blow, or you do yourself. So the depth of compression is 1.5 to 2 inches, equivalent to 3 to 4 cm. 3 to 4 cm. So this is a requirement of the depth of compression, 3 to 4 cm, or 1.5 to 2 inches. 3 to 4 cm. For children's, okay, the depth is half to 1/3 inches. Okay, it's difficult. Just roughly half inches is about 1 cm. 1 to 2 cm. For children's, for adult, 3 to 4 cm. Cm is here. 3 to 4 cm for adult. For children is 1 to 2 cm. Depth. And then for children, you have to use either 1 or 2 hand. So this is I'm not sure yet. Yes, when last week, last Tuesday, Wednesday, Dr. Al Said. Dr. Al Said take you or not?
Yes.
Yes,
Yes,
they teach you how to do the CPR.
Yeah.
Is there any session with him for skill lab?
Yes, already done.
Already done. Okay, I hope you understand that. Okay. So for children, it's different from adult. 30 chest compression for adult with 2 slow breath until people arrive. Okay, within and off until within recover. So advantage this one. This is how you do it. Okay, for single rescuer, 30 to 330 compression with 2 slow breath. If 2 rescuer, 15 compression with 2 breath. Okay, so this is different between single rescuer and 2 rescuer. Okay, single 30 to 2, 2 rescuer 15 to 2. You have to memorize this one. So it came out during the exam. And the exam in the 2 form. One is written, the other one is practice. So practice one is CPR. The other one is actually clinical examination for the clinical methodology. So, okay, if automated external defibrillator available, you stop temporarily the CPR, and then you defibrillate it. After that, you commence again the CPR. So that means you defibrillate, check the pulse. The automated external defibrillator actually is some of this cannot only the electrode to deliver the defibrillator, but actually at the same time, sometimes the electrode also can be used as a monitor, the ECG, okay? ECG monitor, so can see the activity. So this one also depend on the which type of AED, okay? Some AED is only for defibrillate, but some AED not only defibrillate, also can be used to see the cardiac electrical activity. So if it's only for defibrillator, that means you have to check the carotid pulse. Present, not present after the first defibrillation. If not present, you continue the cardiac massage. If present, okay, see the pulse. If good volume, we might not need to do any more cardiac massage. So only support the respiration. So this is how you place the electrode. It depends. If AED, the electrode usually is attached to the skin. Attached to the skin. And will be there, okay? So the place you play, the place is different from the defibrillator in the ward. The defibrillator in the ward actually is not attached. Okay, you need to put it. So we'll show you this during the CPR course or BLS course next week practice. So this AED is different. Okay, you put here on the left side and also one inside the apex. But for the ward one, you put at the sternum one here at the base of the heart, sternum, and the other one is at the apex. So it's different. So while delivering the defibrillation, okay, make sure you do not touch the patient. Otherwise, you also will be defibrillated. Your heart might be stopped. So therefore, before you deliver, sometimes you need to press to deliver, but sometimes it's already automated. So automated that means the machine will give a message with the sound there, okay, to tell you, okay, it's ready for deliver, and then please. So that means you don't touch patient. Otherwise, you will develop cardiac arrest due to defibrillation. So time is very important. So as soon as possible, not more than 8 minutes. So this type of AD, one is automatic, the other one is semi-automatic. Automatic when everything already set. So it just attach only the electrode to the chest and then let the machine work. Okay, do its that. But the semi-automatic, you still need to press after you attach, and you just wait the instruction. Semi-automatic. There are few type. Okay, one is automatic one where the machine does all of the work. There are semi-auto where the machine tell you when to push the button to develop the shock. It's different. So, okay, while setting up the AD, you should continue the CPR. After that, once you already delivered defibrillation, you see the pulse. If the pulse still not there, either you do the second defibrillation or you continue with CPR and mouth to mouth, or if you already have an ambu bag, okay, with the mouth facial mask, and then you continue that ambu bagging. And then after that, you also continue the CPR. After that, defibrillate again. Okay, this is how you manage it. So this is a place I already mentioned just now. So the positive one is actually at the left anterior axillary line. The negative one is actually at the anterior chest wall. So this is how to differentiate. The red for rib, white for right. So you see the cable. Cable, one is red, the other one is white. White for the white cable you put here. Right cable mean white cable mean negative. The red cable mean positive. So this is at the apex. So at the apex, rib here for the red, positive. The negative one, the white one at the right side. This is how you place. Okay. Same thing for the defibrillator. Defibrillator in the ward. So in the defibrillator, it's written there. One is apex, the other one is sternum. You just follow that one. But for this type, automated with the adhesive pad, you see the color. See, this is for pediatric one. I think you already have this before. This is for child, okay, more than 1 year old. So 1 year old. So how many compression we 2 slow blow if you are alone for rescuer. 30 to 2 or 15 to 2 for child. Let's say for 3 years old.
15 to 2.
Huh? 30 to 2 or 15 to 2? 3 years old.
30.
Huh? So
15.
Dr. Al-Said cakap macam mana? Kalau child 3 years old, 4 years old, 5 years old.
15 to 2.
15 to 2.
12 years old,
15 to 2.
still 15 to 2. You sure? Keluar MCQ oh. Ataupun OSCE boleh keluar ni soalan. Make sure.
32.
Oh,
32.
for this is child that 10 years old, 12 years old, maybe 8 years old, 30 to 2. Okay, if 1 year old, infant,
15 to 2.
15 to 2.
15
And
to
then 15 to 2. And then for neonate 1 week old, 15 to 2 also, okay. So have he demonstrate how to do a cardiac compression, chest compression for neonate? You
No.
use a single or 2 pump, 2 hand? You use your thumb, is it? For neonate? Tak ajar ya?
Tak.
But usually
Tak.
neonate is a special condition, usually in the ward, okay? Not at the outside of the ward. But maybe once a while you might see that. So 1 to 8 years old, use 1 hand to perform heart compression. Breathe more gently. Okay, you want to breathe more gently. So if you are alone, perform 5 cycles of compression and 1 breath to the child. This one should be take about 2 minutes before you calling the 991 for help. Okay, that means you must do it within 2 minutes. It's more than 2 minutes. So the boy, okay, or the girl already develop significant brain damage. This is very important for male, for children. 1 to 8 years old, how many compression with 2 breath? 1 to 8. So Dr. Al-Said cakap apa? Ada aja tak? Ha?
Infant
32 ke atau 15 to 2?
Infant 15 to 2.
15 to 2. 30 to 2.
Infant 15. 15.
15 lah?
15.
Okay. Infant is 1 year old. Ini toddler 1 to 8 years old.
32.
2 to 30. Toddler. Infant 1 year old.
15.
So the deep of sternum compression is 1 to 2 centimeter. You use middle and ring fingers. And then the hand, okay, you extend the. After that, if you are alone, 30 compression to 2 breath.
30 to 2.
And you should resuscitate. Make sure that the ambulance come 2 minutes, within 2 minutes. But the problem if you're at home, this is a problem. You won't reach that one. You won't achieve, okay, the 2 minute one. So this is the standard teaching apa? Infant is 15 to 2. Adolescent, some they use 15 to 2, but some use 30 to 2. So for a child, okay, for standard teaching is for adolescent 30 to 2. For infant, 15 to 2. And then for infant, use 2 fingers. middle and ring fingers. For child 1 year to 8 years, you use palm. You use palm compression. This is a finger compression for infant. So okay, if patient is choking, you put it choking unconscious. So what you do? You put at this position. You put your 2 fingers, your third and fourth fingers to patient mouth. You open it, okay, at this position, you open it, you press the mouth out, open. Okay, use your third and fourth fingers. Put at the patient mouth, baby mouth, and then you open it. After that, you pull, and then you put at this position, head down. And then after that, you blow the back. How many blow? 5 blow. And then see whether the object already expelled or not. So that means you have to make sure it's not too strong. Your blow, maybe just enough to introduce or induce there is a compression to abdomen to blow the or to blow the chest and abdomen to blow out the foreign body. So 5 back blow. This position, open the mouth, and then 5 back blow. After that, so another one, followed by chest thrust. Okay, chest thrust use 2 finger, third and fourth. Second and third finger. This is actually to make sure you expel object out. Okay, and then repeat again. So that means if patient choke, position at this position, give a 5 back blow. After that, put at this position, you give a 5 chest thrust. You can see the sound there that suggests, and you can do that and can see sound come out, so that confirm that the foreign body already out. This is to check already. So another maneuver. So this is you just sit at the floor. This one is when you sit at the chest. This one is actually when you sit at the chair. This is when you sit at the floor. This is maneuver you need to do. So you when you sit at the floor, this is how you blow. So that means there is you not blow. This one you blow. So this is you blow at the back. Okay. This is a chest thrust. If you at the floor, you put patient at this position. So it's actually you do a 5 chest thrust to expel the object. But if you position at the chair like this, on the chair, you put patient position at this one, and then you do a back blow, 5 back blow. If it is position at the floor, you do a 5 chest thrust. Use 2 fingers, index and third fingers. Here you use the palm. So this is different.